Today, an award-winning model that expands patient access to mental health care. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This summer, we're sharing the winners of the 2023 ACCC Innovator Awards. The ACCC Innovator Awards showcase cancer centers that are breaking new ground in care delivery. Today, Innovator Award winner Lipson Cancer Institute shares how it adapted the collaborative care model, an approach for integrating primary care providers, care managers, and psychosocial clinicians to improve access to mental health services and counseling for patients with cancer. Earon Lehning is a collaborative care therapist at Rochester Regional Health Lipson Cancer Institute in Rochester, New York.
Collaborative care is an evidence-based model researched at the Ames Center in Washington for primary care patients. And what it is a supportive counseling program for individuals who are struggling with symptoms of depression or anxiety and, maybe struggling to connect with a therapist. So what collaborative care does is embeds counseling within the primary care office. What we did at Lipson in our oncology program, we already had an active collaborative care program within our primary care setting, and we adapted that model to meet the needs of oncology patients within our oncology team.
What's it been like to work alongside the development of the model?
Yeah, it's been really a pleasure for me to be on the development of the collaborative care model for oncology. There's such a lack of resources in this area, and to be able to offer specialized service for patients that really need it and to offer it so flexibly has been really great, really fulfilling.
How has COVID and other events impacted the need for mental health care? Are you seeing an increase in the number of patients with cancer or even their family members who need these services?
Yes, I would say that we have, particularly with COVID, we've seen a lot of our patients have been really isolated, and there is a greater need for support for mood concerns. One of the advantages that we gained through COVID was the ability to meet with people virtually. So we offer telephonic visits as well as virtual video visits. We also provide transportation to patients in need if they want in-person appointments.
What kind of feedback have you received from the model?
Yeah, I think in general, the response has been super positive. A lot of times our social work team, when they're meeting with a patient about other needs, financial concerns, resources, things like that, they identify that there's a mood concern as well, and they're able to put someone on my schedule within, the next 2 days for an intake, compared to where in the community, it might take months to connect with a mental health provider. We know that only 50% of patients who receive a referral for mental health follow up with treatment options. So, it's such a great thing to get people right in.
Why is timely access to care so important here?
I think a lot of times, particularly when you're working with individuals with cancer, there's a crisis and they need support, now and within the next few weeks. Sometimes, just the level of anxiety about upcoming treatments or things like that, it's just really important to get in sooner rather than later. I think that patients get discouraged and they reach out, to private practice settings or, where maybe cost is a barrier or, you run down these waiting lists and you just sit on a waiting list for weeks or months at a time. And, I think patients get discouraged and just don't follow through at that point.
Lehning and her colleagues will present this model at ACCC's 40th National Oncology Conference this October. You can find a link in the show notes to register for that event, held October 4th through the 6th in Austin, Texas. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.